In this lecture, we're going to look at the muscles of the neck and back. Now, the muscles of the neck that move the head articulates with the vertebral column at the joints formed by the atlas and occipital bone, which we call the atlanto-occipital joint. Now, balance and movement of the head involves several neck muscles. An important landmark, the sternocleidomastoid muscle, divides the sides of the neck into two major triangles, the anterior triangle and the posterior triangle. Now, these triangles are very important anatomically and surgically because of the structures that lie within their boundaries. Now, if we take a look over to the right here, we can see the sternocleidomastoid muscle, the midline of the neck, and the bottom of the mandible all make the boundaries of this triangle. And we're going to have suprahyoid muscles and infrahyoid muscles found within that triangle. And we're going to be talking about those a little bit later, the names of those muscles. And if we look down here, this is the posterior triangle. And again, its borders are going to be the sternocleidomastoid muscle, the clavicle, the trapezius, and then some of the muscles that we're going to find within there are going to be the splenius capitis muscle, the levator scapulae muscle, and then our scalenes. Now, this muscle right here actually spans both triangles. This is the omohyoid muscle. If we look up here, we can see it right there. And so this is going to be the superior belly, which is found in the anterior triangle. And this is the inferior belly found in the posterior triangle. Another important structure that's found in the anterior triangle is the carotid artery and also the jugular vein. So those are pretty important. And also some cranial nerves are going to be found in there as well. And the muscles of the neck that move the head. And I'm not going to go over so much origins, insertions, and actions. Down below, I'm posting a link to a spreadsheet, basically, of origins, insertions, and actions of most, if not more, of the muscles that we're covering right now. So go ahead and click on that and download that, and that'll help you with your studies. And so we see here the semispinalis capitis muscles. It's capitis because it's attached to the skull. And so again, this is semispinalis capitis. And then we have splenius capitis right here, and also a splenius cervicis down here. Now, the term splenius, I think it's the Latin. It means compress, like a bandage. And if you think about the old-time bandages, if you ever watch old movies, you know, if somebody gets bandaged up, it's a big, wide bandage that's kind of put on an angle. You know, like if someone's head's bandaged, typically they will bandage it right and left on an angle. Well, anyway, think of this muscle as kind of a wide bandage that's running obliquely. Okay, so that's what splenius means. Again, compress, but bandage works as well. So again, this is splenius capitis, splenius cervicis. And you can imagine looking at this, again, pulling it from origin down to insertion, or actually this is more the insertion. This would be the action. The insertion. The action of that would be rotation of the head, and it would also extend the neck backward if just one side is contracted. If both are contracted, then rotation is canceled out, and it would just extend the head backward. Some other muscles we're going to see, we'll just go down the line here. So the semispinalis capitis muscles, and in case you haven't figured out, on the left side of the screen here, or the left side of the model, is going to be more superficial muscles. On the right side are deeper muscles. And so again, our semispinalis capitis, our splenius capitis. The sternocleidomastoid, there are better pictures of that, so don't even take that one into account. The levator scap muscle, or levator scapula, it's attached to the scapula, and when it contracts, it will lift the scapula up, levator scapulae. But if you kind of fix your scapula in place and contract it, it can also move the head as well. Looking at the deeper muscles, again, you have the longissimus capitis. What else here? We've got the longissimus cervicis here. And so muscles of the anterior neck that help in swallowing and speech, there's two main muscle groups in the anterior neck. There's the suprahyoid muscles, which are superior to the hyoid bone. The infrahyoid muscles, of course, are inferior to the hyoid bone. And both groups of muscles help to stabilize the hyoid bone, and it allows it to serve as a firm base on which the tongue can move. So let's look at those muscles. Now, when you look at these, don't freak out. Don't try to memorize them per se, but look at origins and insertions. So down here we have the sternum. Here we have the thyroid cartilage, and here's the hyoid bone. Now let's just look and see where these muscles are attached. So down here we have the sternum, and this one is going up to the thyroid muscle. So this is going to be your sternothyroid. Okay? This one right here, if I can get my arrow to come back here, here we go. This one is going from the thyroid cartilage to the hyoid. So it's going to be thyrohyoid. Here's a nice long one. This is going to be a more superficial muscle. This is deep. Here we've cut this one out of the way, this one here on this side. So this is going from basically the sternum all the way up to the hyoid. So this is going to be the sternohyoid. Okay, pretty simple, huh? So again, sternothyroid, thyrohyoid, sternohyoid. And you're like, great, I've got this down. Then we get to this next muscle and you're like, uh-oh, I almost have it down. Almost omohyoid. Now, omo refers to the clavicle. And you can see it attaches at the clavicle and then goes up to the hyoid. And we kind of mentioned this muscle when we talked about the triangles. The anterior triangle, you're going to see the superior belly of the omohyoid. And then we have this little connection here. And the inferior belly of the omohyoid, which connects then to the clavicle, is going to be in the posterior triangle. Now these aren't really neck muscles here, but we'll look at them anyway. This muscle here has basically two bellies. You have a belly here, then a tendon that goes through this loop or pulley, and then another belly here. So an anterior belly and a posterior belly. Two bellies, we use the term di for two, a gastric for belly. So this is the digastric muscle. And just pull down on that digastric and see what happens. It's attached to underneath the mandible. So this is one of the muscles that are going to open your mouth. Underneath that is going to be the mylohyoid. And if we look over here at the mandible, we can see the mylohyoid muscle as kind of the floor of the mouth the tongue will be sitting on top of. Oh, and also this is a good picture of the sternocleidomastoid muscle. Again, the sternocleidomastoid starts at the sternum, so that's the sterno. Cleido, which means clavicle. Mastoid, again, the mastoid process behind the ear. And that muscle can do a couple of things. If just one side contracts, it will flex the head and rotate it. If they both contract, it's not going to rotate, but it'll flex the head down. Also, one muscle I forgot to mention is going from the styloid process down to the hyoid. And so we're going to call that the stylohyoid. Muscles that move the spine are quite complex, having multiple origins and insertions with considerable overlap among them. One way to simplify this is to group the muscles based on the general direction of the muscle bundles and their lengths. Many of these muscles are named for the position of the superior attachment site. Like the muscle we already looked at, splenius capitis is attached to the head. Splenius cervicis would be attached to the neck. And the splenius muscles extend the head and laterally flex and rotate the head. Now, the erector spinae muscles include the iliocostalis, longissimus, and spinalis group. And they're responsible for extension of the spine, but they can also affect flexion, lateral flexion, and rotation. And I'm going to give you an easy way to remember these. The iliocostalis, longissimus, and spinalis, that's your I love spaghetti muscles. We'll come back to that. And then we have the transversospinales. They're also named because their fibers run from transverse process to the spinous process of the vertebrae. The semispinalis muscle in this group are also named according to the region of the body with which they're associated. And the muscles extend the vertebral column and also rotate the head. Now, in order to get to these deeper muscles, we're going to have to get through some of the more superficial muscles. Again, on the left side is going to be the superficial. On the right side is a bit more deep. And so this first muscle that we'd have to get out of the way in order to see those erector spinaes is going to be the trapezius muscle. Nice large muscle. And the latissimus dorsi. We dissect those away. We can see the rhomboids. We'll be talking about those later. Here is part of the erector spinae group, the I love spaghetti muscles. There we go. I love spaghetti. And also we can see the serratus posterior inferior. Serratus refers to sawtooth. And if you have like a bread knife, you'll notice that there's little teeth on the bread knife, and we call that a serrated knife. This right here looks like saw teeth, so we call it serrated. Okay, here's the erector spinae muscles. And again, these are going to be your I love spaghetti muscles. The I is going to be iliocostalis. Again, look at where it's attached. It's attached from the iliac crest, so there's the ilio, up to the ribs. And remember, ribs are known as costal. So iliocostalis. And we have an iliocostalis lumborum. So it's more in the lumbar region. The next set of fibers is in the thoracic region. So this is the iliocostalis thoracis. And then we come up to the cervical region, and we have the iliocostalis cervicis. And we can see that with some of the other muscles as well as far as location. And so I'm not going to go over so much the location as the name of the muscle. Now the next one, so I love, so this is going to be the longissimus. And I think of the longissimus as having these very long fibers. Okay. And again, we have a thoracis and a longissimus cervicis as well. And then the next, I love spaghetti. The spaghetti, you can see it going from spinous process to spinous process. And so that's going to be called our spinalis muscles. And we have a spinalis thoracis. And I'm not sure, yeah, way up here you can see the spinalis cervicis. Okay. And so again, spinous process to spinous process. So I love spaghetti, iliocostalis, longissimus, spinalis. Now, these are pretty deep. Going just a little bit more superficial, sitting on top, is the multifidus muscles. I think of it as having like multiple directions that it runs. You can see these are running up, these are running down, and so that's how I remember that it's multifidus. And then over here, we have the quadratus lumborum. It's quadrangular in shape. It's in the lumbar region. As a matter of fact, it's attached to the iliac crest, to the lumbar vertebrae, and then to the ribs. Okay, quadratus lumborum. Wait, let's kind of tie this into our mnemonic here. So we have I love spaghetti. And what goes good with spaghetti? Meatballs. So I love spaghetti and meatballs, multifidus. And if you're at school, taking a break, maybe having some spaghetti and meatballs from the cafeteria, and it's a nice day out, you don't want to sit inside, so you're going to sit outside in the quad. So what we have, I love spaghetti and meatballs on the quad. So see if that helps. And the scalenes, we're going to talk about those a little bit later when we talk about respiratory muscles. And down here, and these are tiny muscles, very, very small. They're not going to create a lot of movement, but they're going to help isolate some of that movement and help the larger muscles as they move the spine. And so this is the spinous process. Here's the transverse processes. And you can see these vertebrae are stacked up on each other. Now the muscles that are in between the spinous processes are going to be called the interspinalis. Okay, interspinalis. These muscles that attach from spinous process to transverse process, well, when they contract, they're going to cause the vertebrae to rotate. So these are the rotatories. Okay, and then we have the muscles that are in between the transverse processes. So these are the intertransversarii. Again, here's the intertransversarii muscles.